Question number 52. A 65-year-old man presents with increasing weakness in his legs over a 6 month period. In the upper limbs, he has a bilateral wasting and weakness in the biceps muscles, and the biceps tendon reflexes are depressed. There is a spastic paraparesis in the lower limbs with increased ankle and knee reflexes and bilateral extensor plantar responses. There are no sensory changes. Which one of the following is the most likely diagnosis? So the options are motor neuron disease, multiple sclerosis, cervical spondylosis with cervical myelopathy, subacute combined degeneration of the cord, alcoholic peripheral neuropathy. So this 65-year-old man with increasing weakness in his legs over a 6 month period. In the upper limb, he has a bilateral wasting and weakness in biceps muscles, and the biceps tendon reflexes are depressed. There is a spastic paraparesis in the lower limbs with increased ankle and knee reflexes and bilateral extensor plantar responses, and there is no sensory changes. Which one of the following is the most likely diagnosis? The presentation of progressive spastic paraparesis in the lower limbs associated with localizing lower motor neuron signs of wasting and weakness of the upper limb, biceps muscles, and depressed biceps tendon reflexes point to a cervical spinal cord lesion and impingement of cervical nerve roots that supply the biceps, which is C5 and C6. The most common cause of this is cervical spondylosis with cervical myelopathy. So option C is correct. Disc degeneration associated with osteophyte formation and osteoarthritis of the spinal epiphyseal joint is collectively called cervical spondylosis, and is a very common condition in the elderly, affecting two-thirds of the subject older than 60 years. It's important to recognize the early feature of cervical radiculopathy due to compression of issuing nerve roots, which may present as nerve root pain, paresthesia, sensory loss, muscle weakness, wasting, and reflexes changes in the upper limbs. Prolapse of the cervical disc may also impinge on the cervical spinal cord and is descending upper motor neuron long tracts with potentially severe consequences of lower limb function with spastic paraparesis as seen here. Other options are multiple sclerosis, a chronic demyelinating disorder with onset below the age of 60 years and more common in women. Demyelinating lesion at multiple sites within the central nervous system occur. Optic neuritis, sensory or motor symptoms. Other cranial nerve lesions and combined spinal cord and brain stem signs involving white matter without other explanation. Prevalence is around 80 per 1 lakh. In this patients, an alternative focal cervical mechanical cause is much more likely. Motor neuron disease is an uncommon progressive disorder of unknown cause in which there is a degeneration of the spinal and cranial motor neurons and pyramidal neurons in the motor cortex. It affects mainly males after the age of 50 years, although an important differential diagnosis in this case is a relatively rare condition with a prevalence of 5 per 1 lakh population. Subacute combined degeneration of the cord is a consequence of prolonged vitamin B12 deficiency, characteristically present with posterior column sensory symptoms associated with the variable symptoms attributable to lateral column degeneration. Alcoholic peripheral neuropathy is a mixed motor and sensory symmetrical peripheral neuropathy. It may be associated with other neurological complications of chronic alcohol abuse, such as a proximal myopathy, giving rise to a complexity of clinical signs. However, the absence of any sensory changes rule out a toxic peripheral neuropathy due to alcohol abuse. So, this correct answer is the cervical spondylosis with cervical myelopathy. So the correct answer is cervical spondylosis with cervical myelopathy.